So if folks can get back, and we'll be ready to go. So we're going to turn now to talking about health policy, and we're pleased to have Phil Cook, who is the ITT Terry Sanford Professor of Public Policy Studies at Duke, one of my alma maters. So I tell you what, Jody, Joanne, sorry to cut off the conversations. Um, Hopefully we'll have a chance to talk some more at lunch. But anyway, we want to give you, Phil, you a full measure of opportunity to speak with us. So please.
Okay, good. Good morning, everybody, and thanks for this opportunity. I actually, yes, I've served on two alcohol-related committees of the National Academy, including the one that reported out in 1981 with a volume called "Beyond the Alcohol and Public Policy: Beyond the Shadow of Prohibition." I remember a very dramatic name, and then a few years later, we did a report on underage drinking. Some experience with this territory. And the first one was what got me interested in alcohol taxation. And so I started a research program on alcohol taxation at that point, and have been there ever since. What I'd like to do today is to talk about a variety of topics, each of them obviously very quickly, that relate to alcohol taxation, including the history of alcohol excise taxes and the evidence that it is an effective as a prevention measure. So just to be clear about this, well, I like to promote alcohol taxation as a measure. I understand that this is a alcohol abuse and alcoholism are multifaceted problems and lend themselves to a variety of solutions. There we go. Including treatment and education and very specific policies for risky circumstances and a variety of harm reduction policies. In the first panel, we used to joke about making the world safe for drunks, and there actually has been a lot of gain that has been accomplished by doing that. And then finally getting to the supply side policies, the alcohol control policies, which include not only tax, but also minimum age and a variety of marketing restrictions. And so just keeping in mind this whole array of possibilities of which tax fits somewhere and is by no means the only option. But the main argument here is that of this great variety, there is the tax issue really has been neglected, and it's been neglected as a public health measure. It's been neglected as a revenue measure, and the result is that alcohol, and especially beer, is simply too cheap these days. To put it in a nutshell, this is an old piece of clip art which is a little bit out of date, but it says beer now cheaper than gas, drink, don't drive. And that is a bit of an exaggeration, but we are getting there, and we can solve that problem very directly and conveniently by raising taxes. All right. Let me give you a brief history of taxes, which this history is something that I put together for the book that I published a few years ago on alcohol control policy. Since the hottest founding father we have is Alexander Hamilton, I'll start with him. And Alexander Hamilton proposed as our very first inland revenue measure whiskey tax. Congress adopted it in 1791. And Hamilton said we needed that tax to repay the debt that had been accumulated from the Revolution. And that, by the way, if it helped promote temperance and moderate drinking, so much the better. And he believed it would do that. But he admitted the main motivation was revenue for this. It was controversial even back then. And it did actually lead to the Whiskey Rebellion. The western part of the states were depending on exporting their grains in the form of whiskey, and they did not take kindly to paying 25-cent a gallon tax to it, so they would attack the tax collectors. And finally, there was Hamilton and Washington showed up in Pittsburgh heading a troop of 15,000 soldiers to suppress the rebellion. It's quite a story. Anyway, Jefferson repealed the tax when he got in. We didn't do anything until the Civil War much. It was revived in the Civil War. It became important there as one of the finance measures. And then even more so afterwards, when the federal government became extraordinarily reliant on alcohol taxes as their source of revenue. Over 80% of inland revenues came from alcohol taxes for the federal government. It was over 30% if you look in the 1890s, for example, were of all revenues, including customs duties and all the rest of it. And so that in a very real sense, it was the passage of the 16th Amendment that made prohibition possible, because the 16th Amendment, which authorized the federal government to institute personal taxation, because without that, we would not have been able to afford prohibition, which of course immediately eliminated all alcohol taxes. So we had the dark years of prohibition and the Volstead Act, no tax collections during that time. We had one of the DuPonts who was crusading to repeal prohibition on the grounds that when he talked to his wealthy friends, he would say, well, we need that revenue so you don't have to pay this terrible personal income tax anymore. We'll go back to financing the government from alcohol taxes. All of this is just to say that it played an outsized role in the history of this country and the history of the finances of the federal government. It certainly does not do that anymore, where it's much less than 1% of all revenues for the federal government. What came with the 21st Amendment and repeal was, for the first time, really, that the states got into the business of alcohol control. That's what the 21st Amendment does, is it gives the states the authority to control alcohol. They can have prohibition if they want to, or they can tax it and regulate it. And so that each of the states eventually instituted a regulatory system with their own taxes. And of course, the federal government reinstituted its taxes. If you look at what happened to the federal excise taxes in probably the high point in recent years, depending on how you count inflation and that sort of thing, was in 1951, where the Congress put the tax on liquor at $10.50 per proof gallon. And that works out, after adjusting to inflation, to 80 cents a drink. So it was very high in those days. The last time Congress got it together to raise the tax was 1991. Okay. So that's very briefly where we've been, and I'm going to say more about that last piece. All right, so looking at the federal tax since 1991, no action in terms of changing the tax levels. what 1991 law did was to set beer at 52 cents a gallon, wine at $1.07 a gallon, and liquor at $13.50 per proof gallon, which is the amount of liquid that has half a gallon of ethanol in it. And that works out, as you see, too, if you adjust for standard drinks that have about a half an ounce of ethanol in them. This way, around a nickel for beer or 3.5 cents for wine, and a little more than a dime for liquor. If those taxes had been adjusted for inflation during that time, which has been a bit more than 80% since then here's the tax rates that we would have in place. Of course, there is no mechanism to adjust those tax rates for inflation. And Congress actually has to act. And that's the peculiar feature of these excise taxes. They're unit taxes. They're quoted in nominal form per unit of liquid. And so without a particular legislative action, then it has the effect of exposing them to general inflation. And that's exactly what has happened at the federal level, is this gradual erosion while Congress refuses to act. The same thing has been going on during this period at the state level. So generally speaking, the state taxes have also been eroded by inflation with very little action. So the general drift has been to lower and lower tax rates on alcoholic beverages during this time, and cheaper alcohol than we would have if we thought that it was worth taxing like we did in 1951 or even 1991. So let me review very quickly the logic of how alcohol taxes affect public health and safety. The higher tax rate, then the first logical link would be that it would result in a higher price to consumers. That's not necessarily so, since the retailers or the distributors or the manufacturers can absorb the tax increase. But this is the presumption that it gets passed along. That leads to a reduced population level consumption of not just the volume of beer or of whiskey, but actually of the active ingredient of ethanol. And with that, a reduced rate of alcohol abuse. And with less alcohol abuse comes a reduction in accidents and in violent crime and domestic violence and chronic heavy drinking that results in organ damage and all of the other things that are associated with excess drinking. Okay, so that's the logic. If each of those links is correct, then it works. And needless to say, each of those links has been contested, and so that there's a debate that goes on about it, which of this is true, which is not. Particularly compelling have been intuitive arguments on a couple of those links that says, no, it's not true. One is that for people who are inclined to abuse or who drink heavily, that they will titrate, and if you raise the price of alcoholic beverages, they'll substitute to some cheaper source of ethanol and preserve their ethanol consumption even while they're reducing perhaps the volume of alcohol that they drink. For example, they can stop drinking on premise and start drinking at home with packaged goods, much cheaper to do it that way. Or they can get $2 chuck instead of fine wine. But obviously it's possible to preserve your alcohol consumption while reducing quality. And that could be a very logical response to higher prices. Another intuitive idea would be that, well, sure, maybe you'll reduce ethanol consumption with higher prices. The people who are addicted or who are most deeply into alcohol abuse, they're not going to change their drinking. it'll be the moderate drinkers, the ones who are not a drinker. So it's a view that the abusers are a distinct group that are not governed by the laws of economics in any normal sense, or at least they don't have a downward sloping demand curve. And so that's the second intuitive argument that kind of follows from some popular notions of addiction and what that's about. Um, Here's the first thing I want to say in response to that, that suggests that in fact the population level drinking is closely linked to the amount of abuse. And that is just a plot of the 50 states looking at the percent of drivers killed where there's some alcohol involvement, plotted against per capita consumption. This might be a chart that you all already have or have been looking at it. I discovered it a few years ago in some work I was doing. And as you can see, there is a fairly tight relationship between those two, and the correlation coefficient is 0.7. In fact, the main outlier is that point in the far left-hand corner, which is Utah. Right. So Utah is not only very little alcohol consumption on a per capita basis, but even low on DUI for the amount that they have. So that's the, but for the rest, and out here we have Wisconsin. Of course, yes. All right. So the research, the systematic research that has been done on this has accumulated over the years. I immodestly like to date it to an article I wrote in 1981, so that's why I say 36 years. But it has been, I think, the harnessing of causal evaluation methods to the study of what in fact is going on rather than simply intuitive judgments about the relationship between price and tax on the one hand and abuse and its consequences on the other. And so that based on that, and much of this literature, starting with the early work that I was doing with George Tauchen, is taking advantage of the fact that of the 21st Amendment legacy, that the states do go their separate ways when it comes to alcohol taxes, and that we can take advantage of the laboratory of the states working just the way it's supposed to in some people's conceptions to teach us about what works and what doesn't work by separate trials in this grand experiment. And so when we do study the effect of that and using a variety of quasi-experimental methods, of which, by the way, the first method that Tauchen and I used was the very first article that used the diff and diff panel regression methods, which became very popular after that. This wasn't our finding. It has been a finding since that. First of all, those higher taxes do get passed through. In fact, they get passed through typically more than 100%, so that sure enough, consumers end up facing a higher price. That they reduce alcohol sales, higher taxes, and binge drinking, chronic heavy drinking. They reduce injury deaths, and they reduce violent crime. There's a variety of other findings, but all of these are direct analyses that relate taxes to the variety of outcomes we care about. And we have also the famous incident of George Bush 41, who said, "Read my lips, no new taxes," but in fact, that was the last time Congress acted, as I had mentioned. It resulted in a 6% increase in the price index for alcohol. And some work that I did recently with Christine Durance found almost 7,000 injury deaths were averted the first year, and the violent crime was greatly reduced during that time using a method I can talk about if you're interested. Let me also talk just very briefly about the distributional consequences of alcohol taxation. That they are, of course, it's easy to fall into this trap of just talking about regressive, progressive. But the more surprising thing about the distribution is that almost everybody comes out ahead in just a financial sense. If you raise the federal tax by 10 cents a drink, that would raise $60 per person on average. But of course, there's a vast disparity in how much drinking, and almost all of the tax is going to be paid by the people who drink the heaviest, or the top 10%. If we returned the revenues on a per capita basis, then about 93% of the public would actually receive a larger check than they paid. And the other 7% are very heavy drinkers. And so it's well targeted in that sense. And that doesn't take into account the fact that there would be other benefits like reduced auto insurance rates and other kinds of insurance rates from the fact that we're on safer highways. So what about cities? You know, if the states are determined not to raise taxes, and that's also true for Congress, certainly cities have a particular reason. They tend to have higher violent crime rates, for example, why they might be concerned about this. As it turns out, and unfortunately in my judgment, most states preempt the cities from taxing alcohol. There are 9 states that give them wide latitude. And so that they can do it, and that's something to keep in mind. There's 5 other states where the large cities in those states are allowed to tax, but not the other jurisdictions, and the rest of it, they can't do it. Okay, and as I'm sure this group knows very well, that while we've had this very static situation of gradually eroding taxes in alcohol, the cigarette excise tax has been going exactly the opposite direction. If you just look at this decade, 2000 to 2010, Congress raised the tax twice, up to $1.01 a pack, and 25 states during that decade increased the tax by more than $1 a pack, and so it goes. I mean, it has continued since then, and the rhetoric around that has become very much a public health rhetoric as well as the revenue rhetoric. And what I would say is, you know, this is really the underlying fact is the master settlement agreement and the withdrawal of the tobacco industry from lobbying. But if we take the rhetoric seriously, what they're saying is that the tobacco tax works and as a public health measure, but the kind of evidence that they're using is exactly the same as the evidence that is available on alcohol. It's just that nobody believes it for alcohol, and so that's the frustration. Okay, so the conclusion is that, of course, alcohol is I think it's still fair to say it's our leading drug problem, and that we should use the full portfolio, and that we have now a strong scientific base, that raising the tax is not just good for state revenues, but it's also good for preventing violence and for preventing injury, not to mention organ damage and chronic heavy drinking. And that, sure enough, just as Alexander Hamilton would have endorsed, that higher prices will encourage voluntary self-control and raise the standard of living for just about everyone.
Great. Well, thank you. So let me kick off this discussion with